Hey everyone and welcome back. Today we're going to talk about iron deficiency anemia, which is one of the most common forms of nutritional anemias. So it constitutes about 30 to 40% of nutritional anemias in preschool children and pregnant women. So why is that? First of all, in the red blood cells in our bodies, the erythrocytes, we have hemoglobin. So we have hemoglobin in these cells. And this hemoglobin is the thing that gives the red blood cells their red color. And in order for our bodies to synthesize, to make hemoglobin, we need iron for that. So iron is a very important factor in this process. Now, that's the symbol of iron, Fe. So, in such cases where we have an iron deficiency, we don't have enough iron supplied to us through nutrition, then we have problems affecting hemoglobin, and this leads to anemia, which manifests in fatigue, weakness, high rate of the heart, so high heart rate, or tachycardia, we would have low muscle mass, so on and so forth. And in severe conditions, we can have neurological deficits. So those are the signs and symptoms that we can get if we have iron deficiency anemia. Now, how does it happen? So it kind of progresses. First of all, we have the first stage. So we have stage 1 of the disease, where it starts with a decrease in the iron storage. Now, iron is stored in a protein called ferritin. So we get a drop in the levels of this protein in the blood because there is not enough iron supplied to the blood. So there is no use of having more of this protein. So we have a drop in the levels of ferritin. After that, we have stage 2. So stage 1 is called pre-latent stage. So this is pre-latent iron deficiency anemia. Stage 2 is called latent stage, where we have normal levels of hemoglobin. We have low levels of plasma ferritin. We have low levels of transferrin. So transferrin is the protein that transfers iron, okay? And we have normal or low plasma iron levels. So that's the second stage. The third stage, which is the final stage, is the iron deficiency anemia stage, where we have low hemoglobin levels, and the anemia is properly manifested and is not latent anymore. So first of all, let's see what are the normal values of hemoglobin that are supposed to be there in the human body. Now that depends on age. So we have from 6 to 59 months, which is around 5 years of age. So from 6 months to 5 years of age, the normal hemoglobin value should be around 11 grams per deciliter. From 5 to 11 years of age, we go a bit more, so 11.5 grams per deciliter, and after that 12 to 14 years of age we get 12 grams per deciliter, and that's for both sexes. After this stage we have the normals for female and males. So females more than 14 or 15 years of age, and males more than 15 years of age. For females it stays the same, around 12 grams per deciliter, and for males around 13 grams per deciliter. And that's the normal values for hemoglobin that are supposed to be there. Any decrease in that will signify that there is a disorder that affects hemoglobin. Now, iron levels are very important to be measured in the tests and the analysis that are done to the patient when they're admitted, because it can differentiate between this kind of anemia and another type of anemia called thalassemia. So thalassemia is another disorder. It's a genetic disorder that affects the synthesis of hemoglobin itself, and we're going to talk about it in a separate video. But the key point here is that the iron levels in thalassemia, they can be normal or they can actually be, so for example ferritin can be normal or it can be actually elevated. It will be very elevated at some point. On the other hand, an iron deficiency anemia will be low. So if you measure blood iron and the proteins that are storing it and transferring it, then you can differentiate between this type of anemia and thalassemia, for example. So I started from 6 months of age here, because before 6 months, newborns are born with an iron storage of 75 milligrams per kilogram, and this iron storage in the newborn is sufficient to push the development of the child till around 6 months. After that, at that point, the diversification of the meals for the kid should start, so that they should be provided with meals that contain iron, zinc, vitamins like vitamin C, and so on and so forth. So that would help in the development of hemoglobin, and that will lead to the healthy development of the child. So this is a very important key point that everyone should know. So this is when the diversification starts. Also, the breast milk is at a peak with the iron levels in the first month after pregnancy, and it goes to the lowest point at the 5th month. That correlates with this one, so right before the 6th month. So at the 5th month it decreases down to 0.3 milligrams per liter. Alright, so that's why also at that point of time the diversification for the meals for the children should be started. Now let's talk a bit about the investigations that we are supposed to do in order to confirm the diagnosis of iron deficiency anemia. So, first of all, we have a complete blood count. The complete blood count will show us that we have a low number of red blood cells, that we have low hemoglobin values, so lower than the values that we just mentioned before. We have low hematocrit, which is the volume of the red blood cells compared to the whole blood volume. So we have a low hematocrit due to the low hemoglobin. We have low MCV, so mean corpuscular volume, which means the volume of the red blood cells would be decreased because, again, of the low values of hemoglobin, so that would be less than 72 femtoliters. We would have low MCH, mean corpuscular hemoglobin, again due to the decrease in the hemoglobin, and that would be less than 27 picograms. Peripheral. Next, peripheral blood smear. Next, peripheral blood smear. In this one, we will find that we have microcytosis. So we have smaller cells. Anisocytosis. Anisocytosis means we have deformities in the red blood cells. Okay? So that all of this is related to hemoglobin, of course. Reticulocyte count. We would have thrombocytopenia. So penia means lack of, or a decreased number. So we have thrombocytopenia, we have leukopenia. So we have a low number of thrombocytes, we have a low number of leukocytes. Then, serum iron. Serum iron, of course, it will be decreased. So less than 39 micrograms per deciliter. Transferrin saturation. So the saturation of the protein that transfers iron, which is called transferrin, would be low. It would be less than 16%. And total iron binding capacity would be very high. It would be more than 480 micrograms per deciliter. And why is that? Due to the low number of iron that's already there. So almost all of the proteins that are about to bind iron are binding iron already, because we have a lack in the storage of iron and the providing of iron to the body. The external supply of iron is low. So we have the iron binding capacity will be very high due to the low demand. Serum ferritin would be less than 12 nanograms per deciliter. So this is where the iron is stored, and we would also have low values for that. So these lab tests and investigations would confirm the diagnosis of iron deficiency anemia to us. Now, how is iron deficiency anemia treated? So it is treated with iron. So you supply iron. Iron has two forms, ferric and ferrous. Ferrous is Fe2 plus and ferric is Fe3 plus. This form is more preferred in the treatment due to its easier binding. So this form is supplied with around 3 to 6 milligrams per kilogram to the kids, and through oral route the hemoglobin would raise with about 1 gram per deciliter in 10 to 12 days. So the treatment has to be continued for 2 to 3 months. Now, in case that there is any problem with the administration of the iron through an oral route, for having digestive problems, for example, irritable bowel disease, celiac disease, or anything that would interfere with the administration of iron through the oral route, or that would affect the absorption or the availability of iron, or anything that would interfere with the treatment, in that case iron can be administered parenterally, so IV, and that would give a faster effect. So that was iron deficiency anemia. I hope it was easy for you, and until the next time, I thank you for watching and see you.